Tonight, Ontario adjusting its vaccine strategy.
Delivery delays are now forcing us to be careful and cautious.
A slowdown in vaccine shipments has the province reprioritizing who gets the next doses as we mark 1 year since Canada's first case of COVID-19. Plus,
I think the UK variant is more than what we think, but they are not detected yet.
health officials in Simcoe County warning against COVID fatigue after more than half a dozen cases of the highly contagious UK variant are confirmed in the area. And
we have all of our frontline officers focusing on the big four, problems with driving.
Toronto police on extra lookout for bad driving behavior this week as part of Project Winter Watch, a campaign aimed at keeping pedestrians safe. Good evening, I'm Kelda Yoon. Hard to believe today marks exactly 1 year since Toronto and Canada confirmed its first case of COVID-19. While the virus is still raging on, Ontario is seeing a dip in cases today. 1,958 new infections were reported today, one of only 2 times this month the daily case count was under 2,000. 757 cases were logged in Toronto, 375 in Peel Region, and 157 in York Region. However, just under 36,000 tests were completed, compared to nearly 50,000 the day before. Ontario is extending its current state of emergency and stay-at-home order for another 2 weeks. The order will now be in place until at least February 9th. The Ford government also providing an update on its vaccine program today. No Pfizer vaccines are coming this week, and next week's supply is smaller than anticipated. As Chris Glover reports, this is prompting the province to make changes to its vaccine rollout plan.
Are you ready?
It wasn't until the first week of January Ontario vaccinated long-term care residents at home.
We should have had these people prioritized at the top of the list right from the start.
Instead, Ontario started with healthcare workers, a strategy that today it announced it's changing.
We're going to get the long-term care homes done as soon as possible.
First doses will now go exclusively to residents of long-term care and high-risk retirement homes, along with First Nations elder care residents. On Friday, Pfizer said no shipments would come this week, and the weeks ahead are precarious too. Geriatrician Dr. Samir Sinha says the government just seems to be waking up to reality.
I think now that we're facing vaccine shortages, we're realizing that the longer it takes us to get these people vaccinated, when other provinces have already done that, the more of these people will die.
So early on we had Pfizer, which meant we could not get to the residents of those long-term care homes.
What do you make of Hillier trying to make the argument that it just even was not possible to bring Pfizer vaccines to these locations?
Well, actually, it was possible, and we know that.
Dr. Sinha points to the fact that December 13th, Quebec vaccinated nursing care residents at home, and BC followed days later. Plus, Sinha says the drug manufacturer sent government's new transportation guidelines December 18th, saying it was okay to do so.
What's done is done, and it's disappointing because I think we've lost a lot of people along the way due to the decisions that were being made in Ontario. However, I think moving forward, I'm glad to see that the government's repositioning and refocusing to make sure that we get the job done that we need to do in the first place.
The new goal is to have all first doses done for these at-risk groups by February 5th. That's 10 days earlier than targeted.
We're running well ahead of schedule. 10 public health regions have finished their first round of vaccinations in their long-term care homes.
But the NDP argues enough vaccine is on hand. It's calling for all long-term care residents to receive their first shot by this Friday.
These vaccines should have been provided to these seniors in December. We're at the end of January now, still scrambling.
As a way to free up more vaccine, essential caregivers and healthcare workers who are waiting on a second dose of the Pfizer vaccine, they'll have to wait a little bit longer. Instead of 21 to 27 days, they'll have to wait up to 42 days. But Canada's Vaccine Advisory Committee says that the same level of efficacy will still be achieved even with the longer wait period. Chris Glover, CBC News, Toronto.
Still ahead tonight, 1 year since our fight against COVID-19 began, our Mike Crawley takes a look back at the lessons learned and the toll the virus has taken. That's coming up a little bit later. There are now 34 confirmed cases of the more contagious UK variant of COVID-19 in Ontario, 7 of them in Simcoe County. As Ali Chiasson tells us, health officials there believe there are likely more cases that just haven't been detected.
I've noticed people have got very much used to the COVID-19.
Dr. Nazrin Nobari has been telling her patients in Bradford that now is not the time for COVID fatigue. It's time to get informed on the new variant in the community.
So I try to alarm them to say, well, we are still at risk.
Roberta Place long-term care home in Barrie had 6 cases of the highly contagious B117, aka the UK variant. Yesterday, a 7th case was identified in the area, and that 7th person is said to have had contact with someone at a long-term care home in Bradford, West Gwillimbury. And that infected person worked at a retail outlet in the region, a store that offered curbside pickup, and now 2 cases of COVID-19 have been linked to it. The Simcoe-Muskoka District Health Unit is investigating all possible connections to the person who tested positive.
I think the UK variant is more than what we think, but they are not detected yet.
There are no additional safety measures being mandated by provincial officials in relation to the UK variant or others, but being extra careful on an individual level is advised.
We have to remember that our existing public health protocols, such as physical distancing, wearing masks, ventilation, all these types of things still work to prevent the variant from affecting you. And it's still very important for us to maintain our public health protocols. And of course, the vaccines can't get out fast enough.
The wearing a mask is one thing, wearing it properly is another thing. It doesn't negate the need for distancing.
Dr. David Williams made one point about mask wearing.
It doesn't mean if you put on a mask, you're going to have a face-to-face conversation with someone for 5, 10, 15 minutes. In the past, you might have got away with the COVID for a few minutes. You will probably not get away with that with the new variant, the UK in particular.
Not all labs in Simcoe-Muskoka test for the B117 variant in COVID cases, so the full picture of its presence in cottage country isn't known. Ali Chiasson, CBC News, Bradford, West Gwillimbury.
Hundreds of employees at a Canada Post facility in Mississauga are in self-isolation. An entire shift of 350 employees has been told to go home and stay there for 14 days. This is a precautionary measure after an outbreak at that building. So far, 212 workers there have tested positive for COVID-19 since January 1st. Workers affected by the move include union members, managers and cleaners on contract. Canada Post is pledging to conduct rapid testing at the site this week. The remaining employees will have to follow strict safety protocols with an increased focus on washrooms, lunchrooms, and locker rooms. A group of Ontario mayors in COVID-19 hotspots say more support is needed for workers who don't have sick pay benefits. The Greater Toronto and Hamilton area mayors and chairs say it's vital for workers to get tested for the virus without fear of losing income. Farm Rally has the details of what they're calling for.
What the mayors are calling for are enhanced benefits, ones that would actually come closer to replacing a worker's income. They want them to be easy to apply for and available essentially right now. Now, the reason why they're making this call is they say that there continue to be outbreaks of COVID-19 in essential workplaces in the GTHA. Now, there are options for workers who are sick. One is through the federal government. That's the Canada Recovery Sickness Benefit that offers about $500 a week for up to 2 weeks. And there are provincial measures that, of course, prevent some employees from losing their work if they're sick. But the fact is people are still going to work sick, and that is a problem. Today, Mayor John Tory said that unless further steps are taken, people are still going to continue to go to work sick, still be afraid of getting tested in case they can't go to work. And he called on both levels of government to take action now. When you have the mayors and chairs representing millions upon millions of people and they agree as one that this is something that is contributing, and it's shared by the medical officers that advise us that this is contributing to the spread of this virus. I don't know how they couldn't find their way clear, the two governments,
to find some resolution.
Now, we know that the federal government has said it doesn't intend on changing its current program, and we know the provincial government has said it doesn't plan on topping up the federal program. So why this continued call for action, and how realistic is it? Well, today the Mayor of Toronto, John Tory, said that he continues to be optimistic something will change. I also had a chance to speak to the Mayor of Brampton, Patrick Brown, about this, and he said that municipalities need to be persistent, and he put it a little bit more bluntly.
I'm sick and tired of the province saying that it's the federal government saying it's the province. They need to come to the table and recognize that there is a cry for this, not only from every labor organization in the country, but mayors in every major urban center in the country. And the reason we are having a chorus of calls for this is because it would make a difference.
Now, on the provincial front, we know that the leader of the Ontario NDP, Andrea Horwath, penned a letter today to the leaders of the Green Party and the Liberal Party, asking for their support for a bill that was tabled by the NDP last month that would boost sick pay benefits. She wants their support once the legislature resumes. However, that's not set to happen for a few more weeks. Farah Morali, CBC News, Toronto.
A man is in critical condition tonight after a two-vehicle collision in Mississauga. Emergency crews were called to the area of Dixie Road and Winding Trail just before 3 this afternoon. The man was rushed to hospital with life-threatening injuries. Police originally said the man had died, but did issue a correction, saying he had lost vital signs and medical staff were able to revive him. The cause of the crash isn't known at this time. Peel's Major Collision Bureau has taken over the investigation. Anyone with dashcam or surveillance footage is being asked to contact police. Well, she is a well-known philanthropist in the GTA's Caribbean community. Now, family and friends are mourning the death of Latoya Elcinder, who was killed last week in Jamaica.
The community is heartbroken. The community is just, my phone has been ringing nonstop just from family and friends. And Latoya she has a large family as it is, but she had an extended family of her community. So she's a well-known, popular person. She used to host a online radio talk show. She's a promoter, so she knows a lot of people in Toronto. So everybody is just shocked and can't believe that something like this, something so vicious and fatal could happen to a person who is known for her giving nature.
The 43-year-old was killed sometime between January 18th and January 21st. Police say she was found in a guest house about 100 kilometers outside of Kingston. Her body had stab wounds and evidence of other trauma. She had been staying with a man inside the guest house. He is considered a suspect and is still at large. The family has started a GoFundMe to bring her body home and start an education fund for her children. Well, the country's first case of COVID-19 was confirmed here in Toronto a year ago. A traveler who had returned from China began showing symptoms after landing at Pearson Airport. Our Queen's Park reporter Mike Crawley looks back at this year of COVID, what's changed, what hasn't, and the toll it's taken.
The case is in a male who's in his 50s. He had traveled to Wuhan, China.
In those early weeks of 2020, when the novel coronavirus was first being imported to Canada, officials tried to calm fears.
The primary message that I want to give Canadians: the risk of contracting coronavirus is low.
As the weeks passed, the cases came from more and more countries, and by late February, COVID-19 was spreading in the U.S.
Probably at that point was the turning point to say, okay, there's a risk here to us. We need to start, invoking public health measures.
That didn't happen until mid-March. Ontario declared a state of emergency and imposed a lockdown. The federal government halted non-essential travel across the border, but did not halt international flights. Health officials emphasized screening people for symptoms.
Don't use a mask in public if you're not feeling symptoms or if you're not been asked to wear a mask.
Had we known clearly that there was pre-symptomatic transmission, I think the way we would have handled things would have been much different.
Although hospitals braced for an onslaught of patients, the real carnage came in long-term care homes.
What's more tragic is how it's unfolding in the second wave now, because there certainly could be steps taken between wave one and wave two to significantly protect the most vulnerable population among us. And, it's awful. It's absolutely awful to watch.
More than 3,300 residents of long-term care have died of COVID-19 in this province, and roughly 40% of homes are battling outbreaks right now.
That we're this far along the pandemic and we're still seeing the outbreaks and deaths from long-term care homes is a complete, it's almost embarrassing.
The one-year anniversary comes amid some signs that Ontario's second wave of COVID-19 may be receding. Still, the second wave is not over. It has already brought more deaths than the first, and more contagious variants of COVID-19 have now spread to Ontario.
Close down our borders and make sure anyone that's coming in gets tested. Mandatory testing.
In the year since that first positive test, Ontario has reported more than 250,000 cases of COVID-19 and nearly 6,000 people have died, making this an anniversary with no cause for celebration. Mike Crawley, CBC News, Toronto.
Coming up, Toronto police launch a pedestrian safety campaign focusing on drivers' bad behavior. Details coming up. Plus,
snowfall on the way, and this time it's a little more widespread. I'm meteorologist Colette Kennedy. I'll tell you how much you can expect and the timing coming up after the break.
Welcome back. Toronto police will have extra eyes on the roads this week. It's all part of Winter Watch, a campaign focused on making the streets safer for pedestrians. Frontline officers will be out in full force cracking down on bad driving behavior. But as Greg Ross reports, one advocate would like to see even more done to make city streets safer for everyone.
So 170 people have been killed on our roadways over the last 3 years.
It's a number Toronto police will be emphasizing all week as they try to raise awareness of the need to make city streets safer. It's part of the Vision Zero campaign. Police will be out in full force, educating and, when needed, enforcing.
Our frontline officers will be focusing on the big four driving problems, the things that cause the most injuries. So that'll be speeding, distracted driving, impaired driving, and aggressive driving.
The hope is to try to prevent scenes like this one from November, when a woman in her 60s was hit by a truck near the Distillery District and died. Police say the majority of pedestrians killed are over 55, and the winter months are the most deadly.
Snow and ice can cause drivers to have reduced visibility, and if you're a pedestrian and you're hunkered down from the cold, you might not be paying as much attention to traffic.
But some say this blitz by police this week is just a drop in the bucket.
This is not about 1 week a year. It's about 52 weeks of the year.
Gil Penaloza is the founder of the organization 880 Cities, which advocates for safer streets. He says the 170 people killed on Toronto streets in the last 3 years is only a fraction of the overall number of people who have been involved in pedestrian accidents.
Many more are severely injured.
He says there are often injuries that have long-lasting impact, adding, if the city really wants to make a difference, it needs to invest far more than it is now.
When we talk about Vision Zero, but we don't put the money or the actions, it becomes zero vision.
He says sweeping changes are needed.
We need to lower the speed everywhere.
And he says there are better ways to enforce speed limits, like getting more speed cameras.
In Toronto, we have 50 cameras, and they are doing a lot, but it's only 50. A city like New York, last year they purchased 1,500 cameras.
Penaloza says he would like to see the city invest in structural changes as well that could make Toronto streets safer. Greg Ross, CBC News, Toronto.
A bit cloudy with clear breaks this evening, but clouds will be moving back in as we head into the overnight. Let's bring in our Colette Kennedy. And Colette, we are nearing the end of January. As far as snow goes, there's hardly been any of it, but we will be waking up to some.
Yeah, things are changing as we get towards the end of this month, Kelda. That's right. So we haven't had a really significant snowstorm since back in December, back on Christmas Day, and that is changing. This is more of a widespread where we are going to be looking at accumulation, so it is going to be a snowy day for sure. Winds out of the northeast are going to be blustery as well, so blowing that snow around means reduced visibility, very poor conditions on the roadways, and then cold air comes in, so this snow is actually going to stick. It's going to be around for a while, but as it's coming down, it is going to be quite a wet snow, so it is the kind that you know, I think a lot of kids sort of enjoy because it's packable. That's what I mean by that. Hey, daytime highs today were mild. We're going to be saying goodbye to that, but we went up to 2 degrees, -2 for London, Hamilton 1, and St. Catharines 1 as well. Now, we do have a snowfall warning that's in place where we're looking at 10 to 15 centimeters. Because of the winds and the lake effect, we'll see some enhancement through these areas, but many other areas, we're still talking about 5 to 10 centimeters, probably closer to that 10. So we have weather statements in place as well. And at times those winds gusting 50 to even 60 kilometers an hour. So that's some sideways snow that we're talking about. So moving in overnight tonight and towards the wee morning hours for southwestern Ontario, a little bit of freezing drizzle mixing in, some wet flurries to start, but really tomorrow morning, 8, 9 o'clock, this will begin pushing through and taking over the GTA and then well beyond on towards Kingston. As we go through the afternoon hours for the GTA, it becomes a little more intense, and then eventually it'll start to taper off as we get into the evening hours. But before it leaves, it's going to be leaving behind areas you see here in the darker blues. That's where we're talking about that range of 10, 15 to close to very localized, but even 20 centimeters. Elsewhere, 5 to 10 back towards the Windsor-Leamington area and Chatham-Kent, but getting into that closer to 10, maybe even 15 for portions of the GTA stretching all the way up towards the north. So this is going to be somewhat significant, and it has been a while. Now, overnight tonight, -8 will be the wind chill, although the temperature -1 for you in Windsor, Leamington as well. 1 degree for the high tomorrow. See that snow tapering off a little bit earlier for you guys. And the lows tonight, -3 to -4, feeling like -10 by tomorrow morning, and those winds really driving in here through the afternoon hours. So temperatures, a little bit of a range through the day tomorrow as we get into those afternoon hours. But what we do know is that very cold air is going to be pushing in behind this, so -7 Tuesday night, but Wednesday -3 for the high. Be nice to have some sunshine coming back. There'll be a glare off that snow, but -12s for those lows the next couple of nights, Kelda.
All right, thanks so much, Colette.
The weather is brought to you by Trane, the most reliable heating and cooling brand. We test, so it runs. It's hard to stop a train.
All right, we've got an update for you on a story we brought you last week. Toronto's own Pickles the Pug is an Instagram star with over 200,000 followers. But the little dog ran into a health scare last week when she had several seizures and ended up in doggy ICU. But it seems Pickles is a fighter.
He's a good baby.
Pickles' mom has been posting daily updates on her condition. She says Pickles is slowly improving, is off oxygen, and has had her IVs removed. She's been seizure-free all week, and vet staff are calling her a free-range pickle as she waddles around the ICU. Pickles' loyal followers and dog lovers alike have contributed more than $33,000 towards Pickles' recovery so far. And that's our show for you tonight. Thank you so much for watching. I'll see you back here tomorrow night at 11. Have a great night, everyone.